Okay, let's travel to Greece. First steps, we aspire to universally newborn genome screen Greece within 5 years. Of course, to be able to do that, we're going to have to show that we can create value in the Greek context. So I think it's helpful to start with where is the HTA, the Health Technology Assessment Policy in Greece today. So the Professional Society of Healthcare Economists and Outcome Researchers recently reviewed the status in Greece, and while Greece gets credit for adopting the initial model, HTA model, in 2018, there's still large room for enhancing both the processes and the structure. And if we look at where the HTA context is today, we can see that it's basically a pharmaceutical-only assessment process that doesn't have any publicly available cost-effectiveness thresholds. So, given the nascent state of the HTA in Greece, how do we think about who the decision makers are and how we can address the criteria that they have? So there's three groups of decision makers. The first is the payers, and this extends beyond simply the Ministry of Health. Philanthropy is heavily involved in both newborn and pediatric healthcare in Greece, and the national government is also working in collaboration with EU co-funded projects to impact healthcare. Now, the second group is the providers. So both for public and private hospitals, this will obviously impact both their capacity and their budgets. And from a public perspective, we're really talking not just about the patients of rare disease, but all citizens who will be contributing and potentially benefiting from this service. So if we go through the criteria of these decision makers, the first, of course, is being able to showcase the value created from a healthcare economics perspective, both from a budgetary and quality of life dimensions. But there are, from the payer perspective, I think 4 additional criteria that are important when we start to build the holistic value case in Greece. So those 4 include increasing positive demographic growth. So the government has made an investment in trying to grow the population. So there's a baby bonus program that's been launched in 2020. So each newborn, every family is subsidized with a 2,000 euro baby bonus. And then there's other dimensions. So the government wants to expand R&D and also increase international orientation. They have an objective to increase efficiency through innovation, meaning both digitization and increasing participation of the private sector. And then finally, we want to have, or the government sets out to have, an inclusive social safety net. So we have designed the First Steps program so that it reaches each of these dimensions. If we drill down on what's our process for measuring the outcomes for economic evaluation, we have a 3-phase process. So we're currently in the first phase, which is determining the current costs. So the second phase is modeling the cost benefit, and the third phase is collecting the real-world evidence to be able to prove out the model. Just briefly, in each phase, the inputs in the first phase is taking our disease list and understanding what the current expenditure is, working with the hospital groups and also the national healthcare system to try and come up with at least an estimated range of what the expenditure is today. Then the second step is our next phase of the First Steps Greece program, which is going to be both sequencing and analyzing 20,000 newborns. And the purpose of that will be to get a clinical incidence of genetic disease in the population. And then we'll transform that into our initial healthcare model, where we estimate the health technology assessment elements, both from a budgetary and a quality of life perspective. And then the final phase is the full rollout on a universal level, where we're tracking both the interventions and outcomes over a longitudinal period so that we can test and prove that the healthcare economics work. And this, again, is part of the first and primary criteria, but it has to be part of a more holistic value proposition that we go through each of the dimensions that I mentioned in the decision maker criteria.